All right, so here's the scenario. You're on an important business trip with one of your coworkers and he collapses to the ground. He's not breathing, his heart's not going. You cry out for help, but all the people around you just kind of stand there and they don't know what to do, and you've never been trained. So this man just might lose his life. Your coworker has a wife and family at home, and you have 5 minutes to help this man to live, but what can you do if you've never been trained? So this is the reason why I'm giving this talk today. So every one of us is susceptible to bad health. And as a result, when we see somebody who's in need, dying on the ground, we should assist in every way that we can. So I'm going to teach you how to do CPR. So I have been CPR certified and trained for the past 6 years now, and I have had the opportunity to speak with many emergency response personnel on the subject. And now this is very important. You can increase someone's chances of survival significantly if you know how to do this. I can't even quote the statistics on this because it's so important to know how to do this. This is basic physiology. So first off, we're gonna talk a little bit about what CPR means, and then we're going to get into more of how to do it, or when to as well. So CPR is an acronym for cardiopulmonary resuscitation, or in plain English, that means somebody's getting someone's heart and lungs working again. So how can you tell when somebody needs CPR? Well, there are several very important things to recognize before you do anything to that person. So first of all, we're going to approach the person, whether or not they need help or not. Calling 911 is always a great thing to do, especially if the person is unresponsive. So let's talk about the things that will lead to CPR. There are a couple ways that could lead to needing CPR. The first is seizures. This is when somebody falls to the ground and they lose muscle control, has jerking movements of any part of the body. That's not normal. Also, this could lead to them stop breathing or gasping infrequently, and that's when you need to begin your CPR. When they're having their seizures, it's important to move things out of the way that they could hurt themselves on so that they don't hurt themselves even more than they have to. So shock is another state. This is the second one. Shock is another state that can lead someone to needing CPR. Most often it can have signs like grayness of skin, confusion, they're agitated, or they're dizzy. And they could also be really cold to the touch. So shock is a state where a person is bleeding internally. And if it's left untreated, that could lead to death. So the first thing to do in any situation before CPR is needed is to bandage the areas that you see that are bleeding and to cover them up with a blanket. The whole point of CPR is to carry blood to the brain that has oxygen in it. And so if they're losing blood, that's less oxygen carrying capability that they have. Also, cover them up with a blanket. When you cover them up with a blanket, you help them to warm up a little bit more, and that's very important, especially when it comes to shock. Now, if the person descends into a state much like what can happen after a seizure, like not breathing, gasping, unresponsive, you should begin CPR as soon as you can. So, let's get into the how. So, you're going to have to prepare to do it. How to find out if somebody actually needs CPR is by tapping them on the shoulders, saying, "Hey, are you okay? Are you okay?" And saying it twice will allow the person a chance to wake up a little bit first. Now, if they're not responsive, you need to either call 911 or have somebody else call for you. And if there's somebody else nearby, make sure that they know where the nearest AED is and send them to go fetch it. So, second is breathing. You're going to check their chest to see if it was rising and falling. It may be that the person is only knocked out or sleeping. So the breathing will be normal if they are doing either of those. You just have to stay and wait by him or her a bit until help arrives. So, but until that time, remember to stay on the line with emergency responders to help guide you through the situation. So now you've gotten to this point where you have this unresponsive, not breathing person. So what do you do now? Now, if your person is neither responsive nor taking breaths, it's time to start doing compressions. So you'll have to take off the shirt of the unresponsive person. I'm not going to do that, but I will show you where to go. This first part of CPR is as a result of practicing, and this could help you make a much, you could really save somebody's life by this way. So compressions are really simple. You will start by pressing down on the lower sternum to help pump blood back to the brain and the rest of the body. So you're going to do one of those for 30 times, and then you're going to press down a depth of about 2 inches. And the rate that you want to push down at is about 100 to 120 beats per minute. So doing it to a popular 80s song is a good idea. Another one, Bites the Dust or Staying Alive, are really good tempos to use. So now that you've done those compressions, it would be wise to also give the person breaths. So lungs can collapse if they're ignored. Breaths will allow the lungs to clear out the alveoli to bring new blood into the lung sacs so that you can oxidate that as well. So you will begin by tilting the person's head back so that the airway is open. Once their airway is open, go ahead and cover the person's mouth with your mouth or with a breath giver. I don't have my breath giver with me, but you will get one once you attend a CPR training. So you will do 2 breaths. Make sure to watch the chest of the person when you do this, because if the chest does not move when you give breaths, then you need to reset that person's head and try to give breaths again. Remember, the goal is to get blood back to the brain that has some oxygen in it so that you can keep brain activity going. So when do you stop doing CPR? When do you know when to stop? So there are 2 times when you should stop performing CPR immediately. Those times are, first, when you have an AED. So that's as soon as you get the AED, you should start to use it and administer a shock to the person that will allow their heart to start so that you don't have to keep doing compressions. If it doesn't resuscitate the person, then continue to give CPR until the next shock can be administered. It's all right to continue the CPR while the pads are still on the person, but so long as you aren't touching the person when the initial shock is given. So the next one is when emergency responders arrive. That's a great time to stop. If you're doing CPR alone, then you will get tired. Switching back and forth between yourself and emergency responder individual will greatly increase the victim's survival. So emergency responders will also administer any other care that is needed at this time. So kind of as a conclusion, CPR can be a very scary thing to have to do, but if you are prepared, then you're not going to be afraid. Remember the steps that you've been given. Right, first, check if the person is unresponsive and check for breathing. Second, call for help or 911 and ask for somebody to go get an AED. Third, begin administering compressions 2 inches deep at a rate of 100 to 120 beats per minute. Lastly, repeat until an AED or first responders arrive. You call back to work to let them know what happened. Your coworker has a wife and children at home, and you ask your boss if he will let their family know what happened. Because you know how to do CPR, you may have saved the life of a coworker, and he may live for many more years with his wife and family because you were prepared to help him when life was at its most important. Thank you so much.